Patients will tell me they feel strong and they feel healthy, but when they look in the mirror, those loose areas don't reflect how they feel inside.
Many people work incredibly hard in the gym, eat well, but still can't shift loose or sagging skin on their arms or thighs.
Exercise can improve the muscle tone underneath, but it can't tighten loose skin. You're exchanging loose skin for a scar. But for most people, that's a simple decision. There's no such thing as invisible mending.
Kia ora, and welcome back to the Cutting Edge Plastic Surgery podcast. Today we're talking about two procedures that patients request after weight loss, body changes, or simply with passing time and loosening skin: thigh lifts and arm lifts. Many people work incredibly hard in the gym, eat well, but remain frustrated because they can't shift loose or sagging skin on their arms or thighs. These areas can affect confidence, comfort, and clothing choices. Today, specialist plastic and reconstructive surgeon Dr. Adam Greenbaum and I will discuss this surgery. Adam, hi.
Hi, Nicola.
Adam, arms and thighs seem to be areas people are particularly self-conscious about. Why do these regions tend to cause so much frustration?
It's because the skin in these areas is very prone to stretching, and once it's stretched beyond an elastic limit, it doesn't bounce back. So that might be due to significant weight loss, pregnancy, aging, or simply genetics. But patients will tell me they feel strong and they feel healthy, but when they look in the mirror or put on certain clothes, those loose areas don't reflect how they feel inside, and more poignantly, the appearance of those areas ages them relative to the rest of their appearance. So with arms, it's often unkindly referred to as having bingo wings. In other words, the sort of loose hanging skin people notice as a fold in their upper arms when they lift their arms. So it sort of sits there hanging redundantly. And with the thighs, as well as the appearance in, say, shorter skirts or tight trousers and jeans, patients will often complain about more functional issues. So they experience chafing and rubbing of that excess skin, and that affects their comfort and their ability even just to exercise.
Let's start with arms. What exactly is an arm lift or brachioplasty?
Well, an arm lift, which is, as you say, properly called a brachioplasty, is a procedure designed to remove excess skin from the upper arms. The goal is to create a smoother, firmer contour from the shoulder down towards the elbow. Many patients, exercise can improve the muscle tone underneath, but it can't tighten loose skin. So even very fit people can have sagging arms, and that's where surgery can help.
Where are the incisions placed?
Most commonly, incisions would run along the inner aspect of the arm, from the armpit down towards the elbow. So it's positioned to be as discreet as possible in all but the most exposed positions. During surgery, I remove excess skin, reshape the underlying tissues, and close everything carefully to achieve as balanced and natural a look as possible.
Now let's talk about thighs. What is a thigh lift, and who typically needs one?
A thigh lift removes excess skin in much the same way as an arm lift. It's particularly helpful for people who've lost a significant amount of weight and are left with loose skin that rubs, pulls, or just simply feels uncomfortable.
Is it similar surgically to an arm lift?
So the principles are very similar. We would remove excess skin and reshape, but the anatomy is very different. For an inner thigh lift, incisions are usually placed from the inner part of the groin crease to extend down towards the knee on the inner thigh. And it depends on how much skin needs to be removed, how long that scar is. And as with all body contouring surgery, planning is very individual, so no two thigh lifts are exactly the same.
Who tends to be a good candidate for these procedures?
Well, I suppose the ideal patient is someone who is as close to their goal weight as possible and has been weight stable for some time, ideally. They need to be a non-smoker in good general health, and they have to have realistic expectations about scarring and surgery. It's important to understand that these are contouring procedures and not weight loss surgery, so that's vital. I also spend a lot of time making sure patients understand the trade-off. You're exchanging loose skin for a scar. There's no such thing as invisible mending, but for most people, that's a simple decision, but it does have to be a conscious one.
What does surgery day look like, and what should patients expect afterwards?
Arm lifts and thigh lifts, they're performed under a general anaesthetic. Patients might need to stay in hospital overnight, it would depend, but we would want to be able to monitor their comfort and assist with initial mobility sometimes, and general wound care. After surgery, you will be wearing a compression garment to support healing and reduce swelling. There will be swelling and bruising, and it's completely normal, but it will settle gradually over a few weeks.
Is recovery painful?
Different people have different pain tolerances. Most people would describe it as tight and uncomfortable rather than painful. I would, in concert with my anaesthetist, prescribe pain medications. People are usually surprised by how manageable it is, and we would encourage you to move as soon as possible. The scars mature over time. They're initially pink and firm, and they gradually soften, and that colour fades as healing progresses.
When do people start seeing results?
You'll see an immediate difference, but it will be swollen initially. The final result will take time to mature. Swelling can take a few months in some people to go down. Scars improve for up to a year, but the results are generally easily perceived soon, and they're very long-lasting if the result remains stable, and it usually does.
What's different about having these procedures done at cutting-edge plastic surgery?
I take a very considered approach. These are major body contouring procedures, and they need careful planning. We have honest discussions, and ongoing follow-up is important too. My patients aren't rushed. Our consultations are thorough, and we spend time taking a view of what the likely goals and risks and scars and recovery will look like. I suppose the advantage of being a specialist plastic and reconstructive surgeon is that my training covers both the aesthetic outcomes but also the fundamental reconstructive techniques and managing any complications. And that's essential for procedures like these.
So, to wrap up, what should our audience take away from today?
Well, I'd say there are three things. Loose skin after weight loss or aging is very common, and it's not a failure of exercise. Thigh and arm lifts can be life-changing for the right patient, and the key in all of these things is to have good information, realistic expectations, and to choose an experienced specialist. If something's bothering you, whether for comfort or confidence, it's worth having a conversation. You can book an appointment at Cutting Edge Plastic Surgery. I'm always happy to talk these things through.
Dr. Adam Greenbaum, thank you once again.
It's my pleasure.